Good evening, everyone. I am Marinel Delantar. So this is Ran, and I will ask some questions about cancer. So because he's a healer or a therapist.
Mhm.
So our first question is, can you please describe what is cancer?
Okay. Cancer is something actually that medicine does not really know why and how does it originate. There is no virus or no bacteria or no clear reason for that. For some reason, the body, the natural mechanism of the body of reproducing cells that reproduce more and more cells, which is a natural process, for some reason it gets out of control and it reproduces over and over and over too much cells, and this is how a tumor starts. And cancer has the tendency to spread. The tumors not only stay in one place, but they start to send like extensions to the body, and eventually it usually causes death. And there are many kinds of cancer. There is blood cancer and cancer that is external to organs, cancer in the brain. Cancer can appear almost anywhere. And they're still searching for a reason. And basically they talk about genetics as a reason. And later on, if you will be interested, I will explain why genetics cannot be an explanation to why cancer appears. And I will try to offer an explanation that I believe is the true explanation for cancer. And if we have the true explanation, we can understand what actually can heal cancer. Without the explanation, without the reason, you cannot know how to heal something. If you go to your mechanic with your car and the mechanic doesn't know what's the reason for the car breaking down, he will not be able to help you. So you go to your doctor, but the physician doesn't know, well, where does cancer originate, why cancer is being created in the body. So he can only help you externally. He can only remove the tumor or give you chemotherapy to fight the tumor, but why in the first place the tumor appeared? If we know the reason, the real reason for why the tumor appeared in the first place, we may know the answer how to heal the cancer. And this is what we're about. And I would be glad to share this.
Thank you, Ran, for sharing what is cancer. So, do you think cancer is need a financial funds for it?
The physician, the doctor, the modern medicine deals with the symptom, deals with the tumor, without asking itself why in the first place the tumor appeared. So they can take it out in an operation, which is a very expensive and very dangerous and risky procedure. If, for example, the tumor is in the brain, its operation can damage the brain, so they can only take only parts of the tumor. They cannot take the whole tumor. And sometimes they take out the tumor, but still the body keep reproducing more tumors. So there's not an actual way to ensure that cancer is beaten. It's always like a war, and always it can reappear. And of course it's very expensive, and you need a whole hospital and operation rooms and chemotherapy and machines and radiation machines, which is hugely expensive and hugely complicated. And all this huge effort doesn't stand on a real understanding of why cancer appeared in the first place. So it cannot really give an answer.
So, why people experience why people having a cancer?
Exactly, that's the question. Why suddenly a tumor appears and life risking? And I will tell you not the direct answer. I will give you first an example. from the clinic. Okay, from the way I deal with people with cancer. A person called, a woman in her 50s. She called, she heard about my work with cancer patients, and she called, and she had a huge carcinoma. Carcinoma is a tumor that is external to the organs. It's not like inside the brain or inside your lungs, it's external. It was sitting, it was as big as an orange, and it was sitting on her heart. A big, huge, like this size of a tumor, developing on her heart, sitting on her heart. And you will understand from what I asked her, what do I think about the origin of cancer. I asked her, and it was a phone conversation, just she didn't even come to the clinic yet. I asked her, what sits on your heart? What do you feel that sits on your heart emotionally? So she couldn't answer. She immediately started to cry. She started crying. She cried and cried and cried, and I was patiently waiting for her to be able to talk again. And I asked her again, what sits on your heart? What do you feel that is laying on your heart? And she told me this story. The story was like this. Her husband was an alcoholic. He didn't work. He was abusing her violently, and he was abusing violently the children. And he was dysfunctional and very violent, and she decided to divorce, to take him out of the house. She was working, and she was taking care of everything, and she was carrying him, her alcoholic husband, on her shoulders. And they divorced. And he told her, look, I have nowhere to go, and please, can you let me stay at our home, like just for a few weeks, until I find a place to go to. So she said yes, okay. And these few weeks turned into 8 years. 8 years that they're divorced, but he still lives at home in the same place. He abuses her violently, abuses the children. He's drinking all the time. He's taking money from her to finance his drinking. And I told her, you're a very strong person. If I was standing in the same situation, I would develop cancer after a month, not after 8 years. But she was carrying all this burden on her heart. So this was the reason. The reason was not something genetic that happened. Her genetics was perfect. There was nothing wrong with her genetics, or with her environment, or with chemicals, or with all this. Her nutrition was okay. She wasn't eating horrible things. She wasn't working in a radioactive plant or something. She was just a person, normal, but carrying a huge emotional stress within her for years. So the body created something that symbolically showed, like in a metaphor, showed in a way that you can see what she was experiencing emotionally. Her emotional experience became a physical one. From feeling for years that she is carrying on her heart this very, very negative story, it became a physical thing, a tumor on her heart. So knowing this, I'm not the only person who knows this. Many people know, and the physicians, the doctors, they know. Many of them know that the reason is emotional. It's emotional. It's not in the body, the reason. The reason is in the mind, in the spirit, in the emotional level of the person. And but many people know, but very little people know what to do with it. They go to therapy, they go to psychologists, okay, let's talk about it, and they talk, and the cancer doesn't heal. So the question is, if we understand that cancer is actually emotional, how do you make an operation emotionally, an emotional operation on the cancer? That's the question, I think.
Yeah. So thank you for that. And do you think a newborn baby will have I mean, do you think like our kids like her parents, or I mean his parents, was arguing with each other and he saw it? So do you think the kids will be experienced all about what do you call cancer? I guess.
You're asking about cancer with children. How does children, how do, with this idea of emotional stress that causes cancer, what happens with cancer with children? Children sometimes that are born with cancer. So what stress did the child already experience? Or in this way of therapy that I call, we label this kind of therapy whole therapy, whole with a W, because it looks at the whole person. It doesn't separate the person into organs and brain. It looks at the whole picture of the person, his life, his environment, his coupleship, his relationship, everything. Whole medicine, WM. So in WM, I'll call it WM. With whole medicine, the way we look at young children, babies and young children, we look at them as an extension of the parents. When the parents experience very, very heavy emotional stress for a long time, the baby or the child may get the cancer. You can say in a way that may sound a little strange, that the baby or the child takes the cancer for them. Like they cannot take it, and like the child takes on himself. And we see children as an extension, not as something separate. So to heal a child, we go to the parent.
Okay.
We work with the parent and the child heals. This is something that happens in the clinic. Happens a lot. We do therapy with the parents, not with the child. The child is healing without touching him, without even having him in the clinic. The parents work and the child heals himself, herself.
So, if a patient or a person like having experienced cancer, so how can you heal them or heal him or heal her?
That's the question. That's the main question. Because, as I said, many people know that the actual reason for cancer is emotional. Sometimes the doctor knows this, and he recommends to the person to go see a psychologist, see a therapist, and so on. And how do we heal? Do we help the person heal? We don't heal. I'm not a healer. I don't have powers to heal people. I'm not doing that. I believe in the person himself or herself. They heal themselves. Actually, they created cancer, which is completely opposite to the very powerful immune system of the body and the very powerful natural mechanisms of the body, anatomy and physiology, to keep itself healthy. So they already did something very powerful. So if they did the cancer to themselves in a way, unaware way, they can heal the cancer. So what we do first is we focus exactly on what the emotional cancer is. Like for that woman, it was all this story with the husband, the alcoholic husband, and all this. And the thing was first to let her express all the emotions that created the cancer. So she was in the clinic, and I was helping her to let out much anger, much fear, much pain. She would cry and yell like insane in the clinic. For at least 3-4 months she was doing this in the clinic. She was expressing in a very straightforward way, not in words, but she was practically expressing her anger in yelling, her fear, in shaking, her pain, in crying. She was doing this for months in the clinic. And immediately when she got in touch with her emotions, the blood tests show less presence of cancer. The blood test showed immediately a positive reaction to the outlet of emotions. Second thing was to take care of the situation. We took all the family in, all her brothers and sisters, the children, they were grown-up children. And we together set a way to take this father outside of the house. He was taken first to one of the daughters, and then they helped him to find work. And we dealt with the real situation, that she will not need to carry this situation in her life. So this was a practical thing. We did an emotional thing and a practical thing. Besides that, we used some meditative techniques that she learns to meditate and visualize her life forward, 10 years forward. One of her daughters had three embryos. She was pregnant with 3 babies. So I asked her to close her eyes and visualize herself playing with the babies, and in 10 years forward, playing outside with them, taking them as a grandmother. She would work on something very positive, like to hold a visualization that is very positive about herself, healthy, happy, and that's what she did. That's what she did. She was practicing emotional outlet. One. Second, practical change of her life, the way of her life, that the life was conducted. Make her life move from a very negative path to a very positive one. And third, holding a very positive visualization of her future. These 3 things, and the cancer disappeared. The cancer was gone. Against all predictions and all, she's supposed to be dead. But instead the cancer disappeared, and it's not one story. It's more and more and more cases for 36 years now. 36 years that it's been going on in the clinic, on and on and on and on. So it's not just, okay, a nice story. It's factual way that deals straightforward with cancer. For as far as I know, for the first time ever. Mm-hmm.
And so since you believe that cancer is based on like an emotion,
Sure.
right? So how can you handle if a patient's going to your clinic and the patient is very very aggressive? How can you deal that?
First of all, it's good. If they express the aggression, it's good. If the aggression is against me, it's not going to work because I need to stay alive. Sometimes it happens that aggression goes to the therapist. It happens also. But sometimes, the clinic basically is mattresses and almost no furniture, so they can go really, really crazy there. Pillows, mattresses, they can express themselves very thoroughly, completely. So we are built for that kind of work, emotional work, which could be very, very intense. Sometimes it gets really intense. I had one wall of the clinic broken once, and sometimes I can get into physical, not real combat with the client, but sometimes like to support. Like he wants to express anger, and sometimes I give him like counter that he can push against me. So it's not real violence, but it's you engage with the client. It's not like a doctor that there is a table between me and the client and there is no interaction. The interaction is very intense. It's very, very intense. You become part of the life of your client. You're not becoming his father or mother, but you engage. It's very different from medicine, that the client may not even remember who you are, just you're a doctor. In this kind of medicine, you become part. You're really engaged. You're really there with the client.
Mm-hmm.
There's a very famous oncologist, American oncologist named Bernie Siegel.
Oncologist?
Oncologist is a doctor for cancer.
Okay.
Doctor that specializes in cancer. It's called oncologist. Oncology is the branch of medicine that deals with cancer.
Okay.
Oncologist. And Bernie Siegel. He started, Bernie Siegel is his name,
Okay.
an American. And he started to understand those things that I'm talking about. And first of all, he took the table out of his clinic. He started to see people face to face, not with a table between them. He can relate to them. And not like watching the computer while he's talking to the person. And he started to ask them about their dreams. He started to ask them about their emotions. And he actually discovered a very similar way of healing. He published some very, very good books on this. But some things in what WM, the whole medicine path, suggests are more specific and more like practical. Bernie Siegel gives like a more grand picture of cancer and spirituality. WM whole medicine is more specific. Is more like I would say surgical in a way, like a surgery, but emotional one. I can tell you about more people, more stories of what had happened in the clinic. Many stories, crazy stories. I'll tell you one story, okay? One story is a person who came with liver cancer in his liver.
From which country?
He was from Russia,
Okay.
actually from Ukraine. And he lived in Israel. He came to Israel. He immigrated to Israel with his wife.
He's a girl or boy?
A boy.
Okay.
A man, 72 years old. A grandfather.
Okay.
And he had liver cancer. Liver cancer is very, very lethal, very dangerous. Usually nobody survives liver cancer. And he had a tumor 9 centimeters in his liver, and he was dying. He came to the clinic. He was yellow from
Jaundice?
yeah, and his eyeballs were completely yellow, nothing white. And he almost
Just yellow?
All the white was yellow
Uh-huh.
because of the condition of the liver. He was almost not able to walk, and he was dying. He was the Israeli. The Hebrew proverb says one foot in the grave already. He had 1 foot in his grave already. And I told him, look, the doctors didn't want even to treat him because any treatment would kill him. Chemotherapy would kill him, radiotherapy would kill him. Even attempting to perform a surgery would kill him. He was dying. He was really, really dying. He was like 80% dead when he came to the clinic. And I told him, look, I cannot promise you anything. I'm not a magician. I'm not a healer. I'm not none of that. I'm not a god. But I can tell you that if you do what I tell you to do, there is a chance. There is a slim chance, but there's a chance that you may heal. Give it a try. What do you have to lose? And he gave it a try. He was very disciplined. He came from a very disciplined culture, Ukraine culture. People are very disciplined. They do every day. So he started to do every day.
Like what?
Rage expression. Like I could see that the immigration. He was in Ukraine. He was very famous. He was very important lawyer. In Israel, he became nothing. Zero, complete zero. And his body started to deteriorate. And he started dying. Because emotionally, he had no reason to live. He lost his reason to live. His passion for life. He had nothing. Okay, so first, we worked on expressing emotions. So every day he would yell, scream with rage, and cry about his let out of all his pain, emotional pain, and dance. We were dancing together a lot. We were dancing a Ukrainian dance that is about the beautiful woman neighbor, the beautiful neighbor woman, which is in Ukrainian language is susitka. Susitka is the neighbor. And we would dance together, susitka, and his wife would watch like this. Okay? You dance about the neighbor. And that's the first thing he did. Every day he was expressing his emotions. His situation became better. He was not yellow anymore. And then we started to work on finding meaning in his life, meaning with his grandchildren, meaning in learning Judaism, meaning in giving advice to lawyers. He became, again, a meaningful person in his true life. It's not something theoretical. He really became more meaningful, more engaged in life, not just sitting like this, watching television and dying. So this was the second thing. The third thing was to visualize. Like he every day visualized himself happy, doing things, going to hike in nature and being with his children. And he was very fonded with his grandchild, a baby grandchild. So I told him, this is your medicine. You have to see your grandchild every day for an hour. So the daughter would bring the medicine. The medicine was the little baby. For the grandfather, he would hug the baby and he was really happy. After 7 months, there was no cancer. The cancer was gone. Now they were very practical people. His daughter was a lawyer, and they had doctors in the family. They went to the principal, to the person who is on all the oncologist part of the department of the biggest hospital in Israel, which is one of the best hospitals in the whole world, famous for all kinds of things they know to do there. Very, very professional. They went to the principal. Principal name is Dr. Hubert. And they asked her, how can she explain? How can she explain a cancer disappearing? Liver cancer. Nobody survives liver cancer. It doesn't happen. How can a cancer, 9-centimeter cancer, disappear? She said something very funny. She says, I'm a doctor. I know a lot about disease and death. I know nothing about health. She was cute. She was actually joking about this. But she said the truth. She knows about disease. She doesn't know about health. And his name is Leonid. And the case of Leonid is one for many, many cases that the same thing happens again and again and again. We see people heal cancer daily. So here in the Philippines, we may start the first school in the world for WM, for whole medicine, for people to know to do this miracle. It's a miracle. Because the world, doctors don't know what to do. Liver cancer? Everybody will tell you. This person, plan his grave. That's what you can do. Make the grave beautiful. That's all.
So thank you for listening, guys, and that's all. Thank you.